Hello, thanks for stopping at Vanderbilt University School of Nursing Psychiatric Mental Health Nurse Practitioner Program website. I'd like to share with you a little bit about the unique features of our program here at VUSN. Of course, we're located in beautiful Nashville, Tennessee, home to the Nashville Predators, the Tennessee Titans, the Grand Ole Opry, Cheekwood Botanical Gardens, and the Parthenon Pavilion, to name a few. So you're here to stop and learn about the position of an advanced practice psychiatric nurse practitioner who's uniquely positioned to help create an integrated care delivery system. We, as psychiatric nurse practitioners, according to the LACE model, which stands for Licensure, Accreditation, Certification, Education, fall under a population foci. And what that means is that we prepare students across the lifespan, treating from womb to tomb or cradle to grave, as some say it. So the APRN role that we prepare you for is the nurse practitioner role. And then the foci is psychiatric mental health nurse practitioner lifespan. And then once you would leave us, you could go and subspecialize in an area such as addictions, forensics, geriatrics. Currently, my area of expertise is working in a psychotic disorder clinic. So as you can see, you would leave our educational program as a generalist, Psych NP lifespan, prepared to work with individuals in both the acute and ambulatory setting. In addition, as I mentioned, we are not setting specific like some other APRN roles. So what is an advanced practice registered nurse Psych NP? You are a nurse first, and I identify myself always as a nurse who has specialized in psychiatric mental health care, and I am educated by an accredited institute, and Vanderbilt is an accredited institute from AACN. And then as Psych NPs, we have one credentialing body, and that is the American Nurses Credentialing Center. So upon completion of an accredited NP program, you're eligible for certification. And once you obtain your certification, then the next step is licensure, either at the RN and or APRN level. For example, some states here in Tennessee, you need an RN license and an APRN license. Other states vary. So as you're exploring your graduate education opportunities, I encourage you to look at your State Board of Nursing regulations, your Practice Act, because that will give you more information about your scope of practice in your particular state. So the American Psychiatric Nurses Association is the largest organization that's focused on education and providing research dissemination for psychiatric nurses, both RN generalists and also APRNs. And the definition they provide is that a psychiatric mental health nurse practitioner is a specialist who provides primary mental health care services to individuals, families, or populations at risk for and having psychiatric disorders or mental health programs. Primary mental health care involves the continuous and comprehensive services for the promotion of optimal mental health, prevention, and treatment of psychiatric disorders. And again, to highlight, we are lifespan and we're not setting specific. So the care you could provide may be in an acute setting, a hospital, a residential setting, or an outpatient setting, perhaps even partial hospitalization. So we treat acute psychiatric disorders and chronic psychiatric disorders with the goal of recovery and remission, treatment to remission, and again, looking at the whole patient holistically. So if you would choose Vanderbilt School of Nursing for your graduate education, you would work with experienced educators and clinicians. We are all practice active. That's one unique aspect of the faculty we have here at Vanderbilt. And we are all involved in scholarship and professional organizations. For example, I had mentioned My practice is over in the Department of Psychiatry at Vanderbilt University Medical Center, and I treat persons who have psychotic spectrum disorders, individuals with schizophrenia, schizoaffective disorder, bipolar disorder, and refractory depression. We are part of a large network here in Nashville. So in addition, you are educated and you receive lectures and information from experts in the field. We do partner with the Department of Psychiatry, and oftentimes individuals will come and provide lectures on their area of expertise. A few more unique aspects of our program here at Vanderbilt. We're one of the oldest and most progressive in the country. We are embedded and grounded in what we used to have prior to the LACE model, which was a psych mental health clinical nurse specialist. And so our curriculum, prior to the first psychiatric nurse practitioner examination in 2000, we had a curriculum that shifted, and we were reading the tea leaves of where the profession was going. We have a deep bench of faculty, and in a few moments, I'll describe our faculty and their area of expertise. Dr. Susie Adams is a faculty member who was in the role of the academic director for many years, and now she's an engaged behavioral health community faculty scholar. And her areas of research interest are individuals who are coming out of incarceration, women with co-occurring disorders, and she pioneered a private practice embedded in an OBGYN office. So you could say that she was one of the leaders in developing an integrated care model. Professor Chance Allen has an expertise in working with individuals who have co-occurring disorders and addictions. And Dr. Alice Burnett has an area of expertise working with veterans and suicide, and also she currently works, her primary appointment is working in the community, and she is the director overseeing quality outcomes for persons with mental illnesses who are in various facilities such as nursing homes. Professor Cloyd came to us. She was first an attorney, and her area of expertise is working in integrative health. Professor Gardner has an expertise in mood disorders and works in a private practice in addition to her part-time appointment at the School of Nursing. Interestingly, Professor Gardner, Dr. Sandy Seidel, and Professor Jenny Scroggie, they all worked in the Department of Psychiatry on the STAR-D trial. And many of you may be familiar with the STAR-D trial. We learned a lot about the treatment of major depressive disorder and response to medications. Dr. Brandy Madden has an expertise of working with adults in community mental health. Dr. Michelle Martins has an expertise of private practice, and she is active working with families who have problems with fertility. Dr. Melissa Ott has a private practice, a faith-based practice, and she treats across the lifespan. Dr. Megan Simmons is an expert in geropsychiatry and works over in the Department of Psychiatry in the Memory Disorder Clinic. Dr. Matt Shore is a child and adolescent expert who works in the community setting. Professor Scroggie is an expert in psychotherapy. She's a trained analyst and has a private practice working with persons with all different psychiatric disorders, and combines medication and therapy, and does do some therapy alone with some of her patients. Dr. Sinclair is a researcher. Her research is internationally known on resiliency. Professor Letizia Smith, she has an expertise in community mental health across the lifespan. Dr. Vick pioneered a practice here at VUMC as a psycho-oncologist, and she works as a member of a team embedded in the Cancer Center at Vanderbilt. Dr. Marcy Zamboki is another child and adolescent expert, and her expertise is working with suicidal youth and also attachment disorders. Dr. Jessica Walker has an expertise working with persons who have serious mental illness, and her current practice is over in the Department of Psychiatry working with individuals who experience homelessness, and she works on the consult liaison team. So when I say we have a deep bench, this is just an example of the full-time and part-time faculty members that you would engage with here at Vanderbilt, in addition to over 25 adjunct clinical faculty, all who are practice active. Our curriculum could be divided as the core courses and the Psych Mental Health NP specialty courses. So the core courses, we have professional formulations, which is learning about the APRN role, and then application of evidence in healthcare environments, and then leading collaborative change, improving healthcare. So that's where you learn things about leadership, economics, health policy, and quality improvement. So we also have what we affectionately call the 3 Ps, and that is what all APRN students have to take: advanced health assessment, pathophysiology, and general pharmacology. A unique aspect of the program here at Vanderbilt is that students have a 1-credit course in advanced health assessment where you're in the clinical setting completing 60 clinical hours doing history and physicals on patients who present generally in psychiatric settings. So for example, here in Nashville, many of our students are partnered with family nurse practitioners, adult nurse practitioners who provide the physical health care to patients at the state hospital, Middle Tennessee Mental Health Institute. So what you're learning is to differentiate. Is this a physical etiology that's mimicking psychiatric symptoms, or is this a psychiatric disorder? And you learn to make those differentials on patients who are presenting with mental health symptoms or who have a mental health diagnosis. And then we'll transition to our courses in the Psych Mental Health Nurse Practitioner program. And what I will do is I'll highlight a little bit about how our program differentiates from other programs across the country. We have a standalone course in theory, and that's theories of individual and family therapy. And that is taught by Professor Scroggie, who is a trained analyst, and Dr. Sinclair. So you will learn about the major psychotherapy theories and application to practice. We have a standalone 3-credit course in neuroscience for mental health practitioners. And this is a really exciting course because the science of the brain and the science in psychiatry is ever changing. And so this is a really excellent opportunity to take a deep dive and learn about the neurobiology of psychiatric disorders. This course is co-taught by a neurologist and also 2 psych mental health nurse practitioner faculty, Dr. Vick and Dr. Simmons. And then we have standalone psychopharmacology course. It's a 2-credit course, which gives you the general principles of psychopharmacology, followed by a 2-credit advanced psychopharmacology course, which gives you more of the application and the art and the science of prescribing. And if you look at other curriculums across the country, both psychopharmacology and neurobiology is often embedded in one of the diagnostic clinical courses. So our program, we believe both in the art and science of prescribing, understanding the science of psychiatric disorders, and that our profession is rooted in psychotherapy. And so our program takes a stronger approach using psychodynamic psychotherapy, cognitive behavioral therapy, and also conceptualizing patients using a biopsychosocial model. And that leaves us to the clinical aspect of the courses. As I mentioned, there's a 60-hour, 1-credit advanced health assessment clinical that's completed, in addition to the 3 psychiatric clinical courses. You start clinical if you are a full-time student here at Vanderbilt in October. And that is a course where the focus is learning diagnostic assessment skills, differential diagnosis, the DSM, in addition to psychotherapy theories and application in the clinical setting. In the spring semester, the clinical course is 245 hours. And you can think about it as a developmental progression of your skills. And in the spring course, you'll add on and continue to do what you were doing in the fall, and then also incorporate more clinical judgment and using clinical reasoning around prescribing. That is when you have psychopharmacology and neuroscience, in addition to group therapy. And then in the summer, building upon, is a time for you to have advanced psychopharmacology to really get into the art of prescribing, and also looking if you're interested in different patient populations or settings. Our program here is 620 hours. Many students far exceed the minimum requirements of those hours. Additionally, we have requirements that you are required to have 120 hours working with the child and adolescent population, 200 hours with adults, and 50 hours with the geriatric population. And then there's another bucket of hours where you, if you're interested in working with older adults or with the child and adolescent population, you can add additional hours with that patient population. So the summer really gives you that flexibility to do that. And then the final course in the summer, which augments your learning, is a population-based mental health care. And what we really focus on doing is having folks leave us as practice-ready clinicians. And in that population-based course, not only do you learn about special populations, but you also prepare to launch your career. And that's by doing things like creating a practice plan, thinking about what's the payer mix that you plan on seeing, how many patients do you want to see in a day, what salary do you hope to obtain, and how would your practice day look to obtain that salary. Also, we practice interviewing skills, and we also have you develop your curriculum vitae or resume. One thing I would add is there's a unique opportunity here at Vanderbilt. We're very resource rich and very resource rich in the area of technology and simulation. So in our program, you have the opportunity to conduct 4 simulated experiences with standardized patients. So in the fall, you learn your basic interviewing skills and you have a simulated experience before you go into clinical and one midway into clinical. And then in the spring semester, we have more complex cases. So you have another simulation at the start of the spring semester. And then midway through, you have what we call an objective structured clinical evaluation, an OSCE. And that simulates the clinical setting where you are doing 1-hour assessment with a standardized patient directly followed by documentation so that the faculty here can evaluate your clinical progress. So that's a broad overview of our curriculum, and you can learn more about it by looking at the website under program plans. We do have full-time program plan and a part-time program plan with entry options as the pre-specialty option, those who are non-nurses who spend the first year obtaining what is a BSN equivalent. We do not grant a BSN, we are a graduate program. You can enter as a direct entry student, someone who has RN license already, or a postmaster certificate, either as someone who is an APRN or a non-APRN. So we have multiple entry options. As far as clinical placements go, we're devoted to you as the student. We have tried and true clinical placements here in Nashville. So all of the students who enter through the pre-specialty program must stay in Nashville for both years. Individuals who are direct entry or postmaster certificate have the option of staying where they are in their home area and then coming to Nashville for blocks of time. We have a hybrid program. And that hybrid program requires those outside of the Middle Tennessee area to come to campus 3 times in the fall, 3 times in the spring, twice in the summer for 3 to 5 days. It is during those on-campus visits that you really get to engage with your peers and get to know your faculty members. And it is also when we do more experiential activities in the classroom. Individuals who are in the Middle Tennessee area, placement examples, so those who are applying or thinking of applying as an outside of the Middle Tennessee area, this could give you some idea of what sites you may be looking for in your area. We partner with Vanderbilt Medical Center and the Department of Psychiatry, both inpatient and outpatient, Osher Center for Integrative Health, the state hospitals. We have 4 state hospitals in Tennessee. We partner with all 4, and all 4 do use psychiatric mental health NPs as direct providers. We partner with the Mental Health Cooperative in Centerstone, 2 large mental health centers in the area. The VA, school-based programs. Our faculty, Genesis Psychiatric, owned by Dr. Ott, Rogers Behavioral, which is across the country, and here in Nashville, their focus is on treating individuals who have OCD and eating disorders. Mercy Clinic is a federally qualified health center. We have private practices. We have residential treatment facilities such as the Next Door, which works with females coming out of incarceration, Renewal House. We also have forensic partnerships with the state prisons and also going into nursing homes. So as you can see, there's a broad array of clinical opportunities across the lifespan. And our modified distance learning format allows you to come as an OMTA student during those blocks of times. And then if there's class that occurs when you are home, you have the ability to watch those courses asynchronously online. We also do network-based case studies and case conferences, and we also devote a lot of time to our student. So in addition to the coursework and clinical, you have clinical supervision weekly with the faculty. And that clinical supervision really speaks to our dedication to prepare you as someone who appreciates the journey of lifelong learning as a psychiatric mental health nurse practitioner, and also developing your knowledge and skills of the role. So that weekly supervision ratio is no more than 1 faculty to 4 students. So, and that can be done either face-to-face if a faculty has all students who are here in Nashville, or it can be done in a mixed method, such as maybe, for example, I have currently 2 students who live here in Nashville. So they come to my office and we use a web conferencing system to link in the other student in another part of the country. And it's a nice way to see each other, to check in and engage in clinical supervision. Upon completion of our program, I mentioned that we have one certifying body, and that is through the American Nurses Credentialing Center. And prior to you leaving us, we provide you with all of the tools that you need to know to launch and be ready to practice. And that is what to expect when you complete your certification exam, how to prepare, what resources are available. And you would have completed the minimum requirement for certification, which is 500 hours. And I mentioned that our program provides 620 clinical hours, and many of our students far exceed that. And after you leave us with an accredited education, you have a Master's of Science in Nursing as a psychiatric mental health nurse practitioner lifespan, and then you would become certified, and your title would be PMHNP lifespan. And the next step would be licensure in your state. And please do take some time to understand what the rules and regs and scope of practice is in your state. The salaries for psychiatric nurse practitioners are probably listed in the top 2 to 3 for all of the APRN groups. And historically, the range, depending on where you're living, could be anywhere from $90,000 to about $120,000 as a new graduate. And there's such a demand for psychiatric providers that none of our graduates ever have a hard time leaving us and finding a position. Some need loan repayment and will go and work in rural and underserved areas and receive federal loan payment. Others negotiate with private employers for some loan repayment. So there's lots of options, and we talk about that through your time here at Vanderbilt. Our cohorts generally are between 55 and 60 students, and they're from across the country. So that really creates a rich learning environment. And you may be sitting in the southeast region of the country, but having peers in the Northeast, Pacific Northwest, or southern area of the country, you will see what practice patterns are there and the scope of practice for those APRNs in the areas. So in summary, I would just like to say thank you again for taking the time to learn more about Vanderbilt University School of Nursing's Psychiatric Mental Health Nurse Practitioner program. It's a really exciting time to explore this profession. And at Vanderbilt, we offer some unique aspects to your education, and that is individualized attention to students, as I talked about with clinical supervision. We have standalone courses in psychotherapy theories, neurobiology, psychopharmacology, and we also are devoted to making sure that you obtain the required clinical hours. So we partner with you as students and help you identify clinical sites, whether that be here in the Middle Tennessee area or outside of the Middle Tennessee area. So what I can say to you is enjoy your journey, explore options, and I hope I've answered your questions about what makes Vanderbilt a different program. Thank you for visiting and watching.